The EP Podcast. Heard everywhere podcasts can be found, and always at theeppodcast.com.
Kind of a fun but hectic last 48 hours for me with the EP Podcast. I'll tell you, it started off with an awful lot of fun on Sunday afternoon into the evening. I had a great time out at Spoke and Vine Wine Bar and Bottle Shop, northeast corner of 95th and Kedzie, as they celebrated their championship, their number one ranking in the Battle of Evergreen Park, as voted on by all of you. And they celebrated in style with a big blowout party over at their location. I was there. I was wearing the t-shirt, which I loved. It says right on the front, drink wine, be happy. On the back, I'm so honored that they threw the EP Podcast logo on the back with their own, celebrating the victory and the winning of the second annual Battle of Evergreen Park. The shirt is beautiful. It's a keeper because somebody told me it brought my eyes out. It was a good night on Sunday night, but I wake up on Monday morning, I got half a show. Like our first guest I had. It's a great guest. We are covering Breast Cancer Awareness Month. And then after that interview was over, I thought to myself, we got to find a way to theme this. And so you'll hear in the first interview, a lot of it talks about your everyday health and women's health. And so I got the bright idea on Monday to go and find one of the rec department programs like yoga or Zumba or all the things that are going on Mondays, Tuesdays, Wednesdays, Thursdays, Fridays. There's a bunch of them that go on Mondays. And I went out and searched with my little microphone, and it took me until 8 o'clock at night to finally hunt one of the classes down. But I did it. I was relentless putting this show together for you. A show brought to you by the First National Bank of Evergreen Park at the corner of 95th and Pulaski in that iconic building. The checking accounts have no overdraft fees. You can take money out of any ATM anywhere, no matter what the charge is. They put the money back in. That makes every ATM around free. And I have tested it out. It's real. It works. Great place to get the kids' accounts set up as well. You can link them all together, use the online banking tools, keep track of the whole household. Stop in and see them today at the corner of 95th and Pulaski, the First National Bank of Evergreen Park, member FDIC. October is Breast Cancer Awareness Month, and here at the EP Podcast, we are fortunate enough to be able to talk with folks over at OSF Little Company and Mary each and every month and check in on things that affect your health. And seeing as how this is such a big month, we have brought in Dr. Jilma Patrick. She is a surgeon. She specializes in surgeries for those that have breast cancer, and she joins us on the phone line right now. How are you, Dr. Patrick?
Hi, I am well. Thank you. It's a pleasure to be here.
Well, thank you for coming on. Now, this is a big month because you're going to see walks and marches and events, and you're going to see the NFL put pink on. Is it important? Because I think that every once in a while, with all the different causes that you see that are constantly happening in the public eye, it becomes, well, this is this week's cause. This is this month's cause. It starts to almost blend in together. Is there still an impact that is felt by you, whether it be people remembering to take preventative actions or the impact of groups that are able to fund surgeries like you might have to perform on somebody? Is there an impact still to Breast Cancer Awareness Month? What do you see?
There's a huge impact for Breast Cancer Awareness Month. October is a very special month for us. It's important because we know that when women are diagnosed earlier with breast cancer, we know that their prognosis or they live longer. So it's very important to spread education or awareness about breast cancer. What
is the most important way to work towards prevention? Is it seeing your doctor regularly? Is it self-examination? Is there something I'm not thinking of? Like, what is your best advice to women out there who may not even have considered it was possible that they could end up with this?
So let me just also mention that breast cancer, we hear so much about it, and one of the reasons we want to spread awareness is that because in women, it's the most common type of cancer diagnosed in the United States when we're not considering skin cancers. And in about 1 in 3 women will be diagnosed with a new breast cancer each year. And breast cancer is the second leading cause of cancer deaths in women. So it's very important. It's out there, and we want people to know about it. I think a misconception that a lot of women have is that If I don't have a family history of breast cancer, then I don't need to be concerned about breast cancer. But every woman should be concerned about breast cancer because we all have that risk of developing it. Some women may have a higher risk than others, but we all are at risk of developing a breast cancer.
That's interesting to me. You know, in my life now, I'm 47 years old. I've met different people. I've known different families. And I have seen some families that I have never been affected by it. And I've seen some families where several women in the same family line all seem to run into it. But you're saying that doesn't necessarily mean that somebody's more apt to get it or somebody's not going to even have to worry about it because they've never seen it in their family. This is something that could pop up for anyone.
So absolutely. We know that sporadic cases of breast cancer, that's the most common types that we see. When we think about hereditary breast cancer or breast cancers that are associated with factors, hereditary factors such as genetic changes, we know that those breast cancers only contribute about 10 to 15% of breast cancers. So that leaves about 85% of breast cancers being developed from mostly reasons we're not quite sure of.
Well, you say that too, not quite sure of, and it keeps popping into my mind. And one of these people is very interested as to why certain things seem to be more prevalent now than maybe they were 100 years ago. You know, is it the food we're eating? Is it the environment that we have around us? Is it chemicals in the air? Is it the way that we live our lives now differently than people lived it earlier?
So we have risk factors that we know for sure plays a role in women. We know for sure increases the risk of breast cancer. When we look at the risk factors, we quantify them as some factors that are modifiable and some factors that we think are just lifestyle-related risk. When we think about unchangeable factors or unmodifiable factors, these are factors that increase our risk of breast cancer that we just can't change. And this is one, being a woman, aging, we can't change that. Genetic changes or genetic makeup. If you have a family history of breast cancer, that may increase your risk of breast cancer. If you have a personal history of breast cancer, that may increase your risk also. Also, race can play a role. We know overall that white women are slightly a little bit more susceptible to develop a breast cancer, but it's really, really important to also note that women diagnosed with breast cancer less than age 40, those women are more likely to be African American women. Now, if you've ever been diagnosed with a high-risk breast lesion, that can increase your risk of breast cancer. And then also the period of time that you're exposed to endogenous hormones, such as, we asked how long or what was your age when you started your first menstrual cycle, what was your age when you started menopause, did you breastfeed, how old were you when you had your first child? All of these things we know play a risk in increasing your risk of breast cancer. Other risks that I should mention is risks that we know that we can make changes, so we call these lifestyle-related risks. Now, drinking alcohol, we know it has been proven, depending on the amount of alcohol, we know that it can increase your risk of breast cancer. We know that certain type of birth controls can increase your risk of breast cancer, not having kids, not breastfeeding, or also we know that being overweight, especially after a menopausal weight, can increase the risk of breast cancer.
I mean, that's interesting to me because you do look at this is something I've been fascinated with for the last couple of years. And when you look back at maybe in the 50s and 60s and the 70s, people there wasn't as much of an obesity problem. People ate differently. But it seems to me like taking care of yourself reduces your risk of everything, including breast cancer. But taking care of yourself has such an impact. It was the same thing with COVID when they talked about, I think we all learned that a couple of years ago. Those that were in better health had less of a chance of it hurting them. It wasn't that they were completely free of being hurt, but it really lessened the chance of really serious complications from it. Your everyday health makes a difference. And I feel like other doctors that have come on here from OSF over the last couple of months have always echoed that in some way. They just say it in a different way. First off, take care of yourself and your everyday health because that's what's impacting these different things that you come across. Am I far off with that?
That is absolutely correct. And that is the number one thing that I tell patients when they ask me, what can I do? Or what can I do to prevent breast cancer? And I always explain to my patients, a lot of these changes that we can do, it's in our control. And it's being physically active, eating healthy, limiting your alcohol use, and as you said, just taking care of yourself. That is the number one thing that you can do for yourself. And I always explain to them it helps in breast health, but it also helps in overall health. So that is a very true statement.
So now let's say that somebody gets the rough news that they have breast cancer. And I would imagine that anytime anybody has to be told we've discovered this, that just shakes them to their core, scares them. They don't know what's going to happen next. There's a lot of different ways that it could go. What's your first advice? Because I know you get to the point where you're performing a surgery, but I'm sure you do a lot of consultations with a lot of different types of breast cancers and a lot of people with a lot of different prognosis. So when it first happens, what is your best advice to somebody who newly discovers that they have this?
As a breast surgical oncologist, most of the times we see patients when they're immediately diagnosed from breast cancer. We're the first cancer specialist that sees the patients. And the first thing that I tell a patient is actually let's relax. We can deal with this. It's going to be a change in life, but this is something we can deal with. With the newer treatment modalities, it's important to note that women are living longer lives being diagnosed with breast cancer. Now, of course, it depends on the type of breast cancer. It depends on the stage at which it is diagnosed. But we have gotten much smarter in treating women with breast cancer, and we have seen longer prognosis of women living longer with breast cancer.
What is Little Company of Mary offering?
At OSF Little Company of Mary, our breast center, we're nationally accredited. We are accredited by the National Association of Breast Cancer Programs, and we offer comprehensive services. Now, one of the things I pride myself, or we as a team pride ourselves, is that we treat patients as individuals and we develop individual treatment plans. I work with the other cancer specialists, which includes medical oncologists, pathologists, radiation oncologists, the radiologists. We all work together to develop a specific treatment plan for our patients. So we offer treatment, we offer kindness, we treat patients with respect, and we understand the journey that the patients are on, because we see patients coming from different backgrounds, different lifestyles. Patients have different types of cancer. So every patient is different. So that's one of the things that we definitely take pride with. We are a comprehensive cancer site, and I know we have other options elsewhere. But at Little Company, OSF, we offer all of the treatment modalities and services that you can find at any other hospital locally. But I also like to take pride in just knowing that we're a smaller community hospital, and we kind of have a very close relationships with our patients.
Yeah, it seems that that's something that happens over there is because of the size. It's more personal, which I think you would probably want if you're going through something like a cancer diagnosis. Is the trend now like a collective, like people that attack it from a bunch of different angles? Like the way you describe it is almost like a team is working on trying to find the best path for the patient. Is that a new thing in recent years?
Well, that is a thing that's been going on for the past couple of decades, but we know and we have seen the differences or the outcomes in patients when they're treated by a multidisciplinary approach versus patients who are not. So that is a huge thing for us when we say we have a comprehensive breast center, because we have specific specialists that focus on breast. I myself, I'm a breast surgical oncologist, so I focus on breast patients, whether it's benign or malignant disease. We have our medical oncologists that majority of their practice is with breast patients. Our pathologists is the majority of breast pathology. We have radiologists that only look at breast images. So we are highly specialized in this particular area so that we know that we can give our patients the best expertise, the best treatment options, and we just have a closer relationship with patients because this is all we do all day long.
How often do you think somebody should get checked? What are they looking for, and how often should they do it? So hopefully when they get to you, it's been detected early and there's a much greater chance of not only survivability, but just a better outcome altogether.
We want patients to become aware of the breast, to have an understanding of what the breast looks like, what they feel like, so that if they notice any changes, or if they would be able to know that this is a change that's different than what they noticed before. And we usually would say maybe starting at age 25 to 30. Again, everything depends on your family history. Now, we are really trying to have women, even as young as age 25, start having risk assessments. Risk assessments looks at a number of different things, mostly including your family history, trying to determine if this is a patient that is high risk, that maybe shouldn't wait until age 40 to have a mammogram, that this patient should have imaging or other follow-ups done sooner than that age. So we are trying to promote that when women come to see us, we give all women risk assessments to try to determine, hey, should we change the way that we are doing surveillance in you because of your family history or your personal history of something that we should know about. So breast cancer awareness, knowing your breasts, getting to know what your breasts feel like, we recommend that you start that probably at age 25, between 25 to age 30. Mammograms, average risk women, we recommend starting at age 40. If you are high risk, and this can be determined by a risk assessment, then sometimes these women may need to have imaging done maybe at age 30 or maybe even earlier, depending on their risk. The other important thing that we should discuss is genetic testing. Now, we have a genetic counselor on site, and we screen women to determine if genetic testing is something that would be appropriate. And this is based on their family history as well as some other factors. But sometimes we find out information about patients that we may not know, and patients may not know that they're high risk. And some of these women, we have undergo genetic testing, and sometimes we do find gene mutations that make these women susceptible to breast cancers that no one else in the family knew that they had. When we find women with gene mutations, some of these women, they need to be screened earlier. These women need to be counseled. Sometimes there are medications that can be given to some of these women to try to prevent the risk of breast cancer. So one of the main things that we are concerned about is finding women that are high risk to ensure that they're getting the proper surveillance and they're starting screening at the appropriate times.
Dr. Jilma Patrick, nice enough to join us today. I really appreciate it. Very informative. OSF Little Company of Mary, of course, a community hospital right here in Evergreen Park. And Dr. Patrick, I appreciate you jumping on the EP podcast. Thanks so much.
Sure. Thank you so much.
Building relationships, supporting the community, and service. These are the things that Country Financial stands for. They're more than just an office you may pass by as you drive through Evergreen Park. They're neighbors who lend a helping hand and support the fabric of your community, including charitable organizations, sports, financial education, and civic organizations. And since Country is already your neighbor, they want to get together and chat. Call your local Country Financial representative, Mike Thauer, today at 708-425-1559 to talk about the things that are important to you and how he can help you protect them. It is now time for your EP podcast, Word on the Street, brought to you by Spoken Vine, Northeast Corner, 95th and Kedzie. Voted number 1 in the Battle of Evergreen Park, and they're proud of it. They also have a lot of amazing wines from all over the world. I tried 4 different Serbian wines. I didn't know Serbian wines were so good. I will be honest with you, though. The Italian wines are the best. I mean, it might be because my last name's Lanuti, and I'm Italian, but if you're into the Spanish ones, the French ones, the Serbian ones, or whatever, they have it all there. See more at SpokenVineWines.com. This Saturday, kicking off at 2 p.m., going until 9 in the evening. Music, food, drinks, and fun for all ages at the Evergreen Park Oktoberfest, October the 5th. That is Saturday. Come out and see us at the EP Podcast tent. Cannot wait to see you there. Mark your calendar right now. Sunday, November the 17th, Bears-Packers, starting at 11:30 in the morning. Evergreen Park Community High School Scholarship Fundraiser begins at 115 Bourbon Street, and you can buy tickets for $40 in advance or $45 at the door. Go watch the Bears destroy the Packers with a buffet, select beverages, and desserts included. Limited reserve tables for 4 or 10 for an additional fee, and there's raffle baskets, split the pot, football squares. For more information or tickets, call or text Steve at 708-542-7330. All proceeds go to the EPCHS Scholarship Fund to help students continue their education. This month, the month of October, the Evergreen Park Public Library has their Book Club for kids in 5th grade and younger. Read or be read to for 4 hours during the month of October and get a trick-or-treat bag and some goodies. Log your time spent reading using a paper log or Beanstack. Get more information at evergreenparklibrary.org or check out our last episode before this one on demand anywhere podcasts can be found and always at the eppodcast.com, where Frank Murray joined us from Spoken Vine and told us about the Book Club and everything else going on in October. Remember to show your love for Evergreen Park businesses. Spend $40 or more across 3 different categories of business in Evergreen Park and get a new EP sticker for your bumper with the heart on it. Keep the green in Evergreen, and you can get those stickers at Village Hall until October the 18th. Go to the Village website to get more information. And I mentioned at the beginning of the show my search for different classes that celebrate women's health going on here in Evergreen Park. And this isn't specific to women, although I've never known a guy that does Zumba. But if you want to do some Zumba, Joe Moran Zinn hosting a new class kicking off on October the 7th, Monday, coming up, going through December the 16th, 10 a.m. or 6 p.m., your choice. There's also a whole slate of other times and dates. Looks like they got some Wednesday ones as well. These are 8-week classes for $80 over at the Senior Center. For more information, call the Rec Department at 708-229-3373. I did find a class. It was yoga, happening every Monday night over at the community center. I always talk about these programs, but I never actually check in with the people that teach them. Today was as good a day as any to do so. I'm at the Evergreen Park Community Center. Gail Morales is here. She teaches a lot of classes for the Rec Department, and she's doing something called YQ Yoga. All I know about yoga, Gail, is what I just Googled, because I was like, okay, I think I know what yoga is. I read something where there's like all kinds of different yoga, and then you have one that's like a combination of yoga and something else, and that's where this YQ comes from. Explain this to me.
So it's yoga qigong. So we're doing basic yoga, easy yoga asanas or poses, some simple stretching, and then we'll do that for about a half an hour, and then we'll go into 20 minutes of qigong. And qigong, qi means life force energy, which is in all around us, and gong means practice. So you're putting the two together, and you're working with the inside of you and trying to calm yourself. And I always tell people whenever they're at a train, do your qigong movement, because that train's not moving any faster, so why are you getting upset?
Yeah, that'd be awesome too. I would love to be on a train and just see people doing weird movements out on the side.
Or even breath work, like serenity now.
You're like, get it in there, and I'm like, yeah, put on a show as I'm sitting on the train. I want to see somebody doing it.
And you know, at this point in life too, it's like I'm not going to see who's behind me or on the side again. So if I want to raise my arm up and center myself,
nobody's paying attention. They're on their phone.
Right, they're on the phone, or they're on their listening to music. Maybe they're laughing at you, but again, as I tell people, I'll never see you again. Right. So
that's awesome. Well, what I picked up right away coming here to visit you, I showed up right at the beginning of class, and I was like, oh, she's just about to start her class. I'll wait till the end of it. I knew a couple of different moms that were in here. So there were several ladies that were in here, and one of them was talking to me afterwards, and she's like, I didn't know what I was doing. I was very worried. It was like a beginner thing, and it seemed like some other people had been there, but she was like, I could pick it up because your thing was more like you were kind of describing it, like you didn't have to be perfect in your pose. This is a good class for somebody that's never done yoga before.
That's right. This is perfect for all ages too. And I do bring in some of my props. They have the village has props as well, so we could adjust if you have knee issues, or if you have. We were doing a balance pose today. In fact, some of them are like, oh, and I said, no, we'll work it with the block. You could just put your foot on the block. One foot's on the ground, one foot's on the block. It's not really high up, so you'll be fine.
And you do this one, the YQ Yoga, and it just kicked off. First off, this show coming out on the 1st of October, and we're talking, your first one was the night before on the 30th of September. If somebody wanted to join, are they too late for this one? Do they wait for another one?
I'm going to hold the I'm going to ask the rec department if they keep the registration open for another week, and they can start their class next week. They'll probably maybe give a discount off the price.
That sounds great. I like that. Yeah, you're working it out.
This would be like, where else can you go? Because I'll tell you, studios charge a lot. So this is just...
This is exactly what somebody just told me walk out of there. They're like, what is this? It's something like $40 for like, or whatever it is here.
$60 for 6 weeks.
60 for 6 weeks. So they're paying
$10 a class.
Yeah, and a lot of studios are like $40 or $50 for a class.
They could be $20, $25. In fact, there's one studio that's about $28 a class. They want you to buy a package. So that's why they charge high for individual classes. The rec department here is just wonderful, and this is open to anyone to come and practice and just spend an hour laughing and just relaxing and chilling.
It seemed like a really relaxed thing. Like, I feel like if I went to a studio and I was paying a higher price, I mean, I know yoga is supposed to be like a relaxing thing, but with any class, especially when people are exercising or doing something, there are psychos. There are people who are like, this is like, they want it to be absolutely perfect when they do it. They're really into whatever it is that they're into. This seemed very relaxed here at the community center.
Right. You know, years ago, I've been teaching yoga for about 10 years, and I've been teaching Qigong for about 2 years. And I've been practicing yoga for over 20-something years. And before that, up until about 8 years ago, I was that girl going to vinyasa, wanting to do that handstand, wanting to do that scorpion pose. And then it's like, okay, but I want to go and lead a peaceful life, you know, and just kind of calm down. I already proved myself that I could do it. Now it's like, I just want to live simply and help others to relax and be mindful and just chill.
And you do these classes in other places besides Evergreen Park, but we were talking before we got started, the facilities. Like, I'm here at the community center, right here at 97th and Holman, or right off of Klein Park, and we're sitting in one of these rooms that I've been in this room before when there was a marketplace in here. I'm sure during Oktoberfest there'll be something else going on in here. And so, but the facilities are just, they give you a lot of room, it's clean, there's a lot of space for you to kind of do what you want to do. Speak about what Evergreen provides that you probably don't get everywhere you go and do your classes.
Well, I bring in my own blankets because I like to have something underneath the head, but I wash those as well when I leave. But they provide blocks, they have mats, they have straps. I bring in some of my own lighting to set the mood, you know, to make it a peaceful, welcoming type class. So I bring in some of my own lighting and they give me some as well. So it's just, you know, and then during the summer, what I love is, since it's now getting darker, but when it's lighter at 8:30, you can still look out and see the trees. And so Qigong is more nature-oriented, so just sitting out there and looking out at the trees, doing simple movement.
Yeah, we're in a room that...
can you do?
To describe it for everybody, we're in a room that has like just a lot of glass like on the corner of it. Right. And so you get a lot of light that comes in here. I can imagine that's awesome. Now, you do this class... I know there's all kinds of other classes that the rec department's doing. They've got Zumba going on. I've seen, you know, the signs were up when I came walking in here. What else do you do? Because I know you don't just do this one, right, for Evergreen?
Right. I do a lot of libraries. In fact, I taught at Evergreen Park Library, and I might do a simple stretch with sound and bringing in some gongs and some chimes and my crystal bowls. But I also do a lot of other libraries and teach a combination of chair Qigong with sound or chair yoga with sound.
Because you're doing just a separate just Qigong one too coming up, right? I think I saw that starting, or did it already started on Friday, right?
Yeah, that was a chair Qigong at the senior center.
What is that? You just sit in a chair and do it?
Yeah, just simple movements in the chair, just relaxing, doing some breath work, you know. I play the bowl on that too, just to get people relaxed when they leave. It's kind of like a grounding when you play a certain bowl, because I don't want to leave people floating.
You're playing a bowl. Like, I think people are listening, they're like, what is she saying? Yeah, she has a bowl. And what do? You run something around it?
It's a Himalayan bowl, and I do rub, like, there's a mallet that...
Playing a water glass, but it's a bowl.
Yeah, and I have crystal bowls, too, so that I might bring in a crystal bowl and just kind of go around the outside of it, so it gives a nice little frequency.
Does that help with the relaxation?
Oh yeah. I get a lot of people. It's interesting because I've gone to a lot of sound journeys, and when people play real loud, it just gets your nervous system. And here I've got you laying down, relaxing, and I'm playing loud, and you're going, but you play nice and soft. Just get them used to it, and just, ground them. So when they leave, they could feel like that was a good class. I'm not overly tired. I feel good. I want to sleep tonight.
Well, Gail has this one going on right now, like she just said. The first YQ Yoga happened on Monday night, 7 p.m. It goes until 8 o'clock. And then that's going to continue through the 4th of November. You can still get in on this one. There's also the Qigong. Am I saying it right?
It's the chair Qigong, and that we kept the registration, even though it started last Friday on the 27th. It's still open until this Friday.
And you do a lot of programs. You were telling me, like, I do 6 weeks, I take a couple of weeks off, I'm back with another one. So if they miss this one, it's always around. And I think it's important that people know about these programs, because I'll read them off on the show, and I know that they'll put out all their bulletins and stuff like that. But it was kind of neat to see one in action tonight. You had a good sized crowd at this.
I did. I've been very happy, and a lot of these people have been with me over a year that have continued to come back and look for that after getting off of work.
Does it become a club? Is that what it kind of becomes? Like they all kind of they get used to each other, and it becomes like a little bit of a club.
Right. It's like a community, so everyone knows everyone by name, and it's like it's kind of nice. And so the newbies that do come, I introduce them and work around, and we laugh. So it's not like I always like to say I like people to feel energized and relaxed more so than when they came in. So when they leave, it's done with a smile and it's done with feeling good.
It's the EP Podcast, all things Evergreen Park. It's the EP Podcast, Evergreen Park.